Hi, welcome back to the channel. This is Jen, your Medicare and retirement guide with over 2 decades of experience in healthcare and in retirement. Today we're going to talk about saving your money when it comes to selecting the right insurance plan for you. Please like and subscribe to the channel, share to anyone who might find this information useful. And other than that, let's get into it. I'm actually going to use my dad as an example because he is my favorite yet most difficult client that I love to have with me. So I'm going to use his plan as an example. So he's considered a Medicare Medi-Cal. And he was given some information about switching to a PPO plan without them letting him know that if he does switch over to a PPO plan, he may end up having a miraculous bill in the mail. Why is that? He's also Medicaid. Well, Medicaid has different rules to how they bill and the kind of plans that they cooperate with. And they do not cooperate with PPO plans, and yet somebody was trying to convince him to go ahead and switch to a PPO plan where he would have co-payments and premiums and all these different hidden costs that were just not explained to him. So let's go into that particular subject and how is it that you can avoid doing those mistakes yourself. So the first step is to not auto-renew without shopping around. Now, every year, plans change on a continuous basis. Some plans stay the same, others reduce their benefits, others increase their benefits. Every plan should always send you the summary of benefits and the evidence of coverage every single year if their plan changes for the following year. So always make sure that you get those pieces of information in the mail or email, whichever method you selected for, and always review that contract. For example, like we said, my dad was given a small piece of information. He is trying to do his due diligence. Thank goodness that he uses me so he can double check with me to make sure, hey, I want to change into a PPO plan. Is that recommended for someone who's Medicaid and Medicare? No, it is not. It is only during certain circumstances that someone may consider that may come out to be a better option. But please, there are so many plans out there. Just for Southern California, there's over 360 Medicare Advantage plans. Be careful on where you switch, always review, and always make sure that it's someone that you truly trust that is going to go ahead and explain to you your benefit options. Now, I brought this up in previous videos before. Always adjust when your health changes. It's not just you're changing medication, changing your physiology, or changing your zip code. It's also changing your finances, and it's changing your providers. So remember always, healthcare is always a constant movement of flowing parts. Sometimes doctors don't renew contracts with a medical group. Sometimes they retire and you're left without a doctor. Same with the health insurance plans. They're constantly changing. Some may be terminated. And then there's others that they're going to just reduce the benefits. Things that you were offered before, all of a sudden they disappear and you have no understanding of why those benefits disappeared. So it's always important to always reach out to a trusted advisor in Medicare to go ahead and explain why is it that things are changing and where to proceed depending on your physiology, your financials, your coverage in terms of doctors or medication, and or maybe you just moved to a whole new area and you have no idea what you're doing. So it's okay. Always ask for help. Now, using my dad as an example, he has me. I'm his alpha daughter. I'm always going to be his cheerleader in his corner, and I'm always going to look out for his best interests at heart. But not everybody has an alpha daughter or an agent within the family. So it's really important to know where you can get your information and how to properly compare your options. You can always call your insurance company and ask them, is this plan really the best plan that can be offered to me at this time? If you like your insurance company, you like them, they haven't messed you up, and you can stay with them. But just make sure that you can see, okay, what other plans are out there? Can I upgrade my plan? The second thing you can do is that you can reach out to multiple companies and see what information they can send out to you and compare your plans that way. There's always Medicare.gov. It's not perfect, but it's pretty decent, and it can give you some information, in bullet points to make it simple and easy for you if you want to do the research yourself. You can reach out to independent Medicare advisors, such as myself, but you can reach out to your own trusted advisor in your neighborhood, in your area. Make sure it's someone who knows the market, who knows the different zip codes, the counties, the state, and they can go ahead and walk you through your options, and what is available in your area. Not every zip code is the same. So just keep in mind, plans that are offered in one county may not be offered in yours. So just keep that in mind when you're reviewing your benefits. And then just remember, this is complex. You're not expected to know all of this stuff. I live, breathe, eat, sleep in premiums. So I do this in and out every single day. And I do represent multiple companies for myself, but I'm not expecting every single agent to be in this as much as I am. So just make sure that you reach out to those who will give you unbiased, professional advice when going about selecting a new Medicare plan. I wanted to go over a couple of myths about insurance agents like myself. Usually what I get a lot are, you get paid by the insurance companies. Why should I trust you? Because how do I know that you're not picking favorites between insurance companies and I'm just getting whatever it is that you are going to get paid out most of? Just so you know, insurance agents for Medicare are paid, yes, by insurance companies at a flat rate determined by our government. So Uncle Sam really does pay me to help you. So, and that is for any agent out there that you are working with. And it depends on the rates of whatever state you belong to. And you as a consumer can actually look up how much I get paid. So if you ever wonder how much agents in Medicare are getting paid, that is actually public domain. You can always look it up and see, depending on what state you're in, and you can see how much the insurance agent is getting paid by the insurance company. I do get paid the flat rate for the state of California, my home state. I am licensed in multiple states as well. So if you are interested in using my services, completely complimentary, I don't charge. I just want to make sure that your physicians are covered, your medications are covered, and that you're getting the best plan in your zip code. In addition to that, why use an agent altogether? Well, and I want to pose that question to you. Would you buy a house without using a real estate agent? Would you go to court without an attorney? So when handling probably one of the most important decisions of your life, how to manage your health care, why wouldn't you want someone who lives, breathes, eats everything that has to do with insurance? Again, even if you don't choose me, that's okay. But make sure you choose somebody who studies this on a regular basis that can give you an honest opinion about that. And there are plenty of resources out there to go ahead and select the right person for you as well. I would be honored if you chose me, but it's all good. At least if this information helps, keep clicking and subscribing to it. Some objections that I typically get on a regular basis: is this gonna take too long? I don't have an hour to go over my benefits. I really do need to do this every single year. I've heard it all. All of my consultations personally take around 20 minutes to get your doctors, and you can make it even faster as long as you have your doctors ready, your medication list ready, zip code, Medicare card, any other things that we need to know as insurance agents. You make sure that you have that information ready and you disclose it to someone that you trust with your healthcare options. So that's it. That's the end of the video. I hope this was helpful to you. Remember, like, subscribe, share to those who you believe would greatly benefit from this. If you are interested in using my services, again, complimentary, click my link in the description. Comment on what you'd like to see next in the terms of our healthcare here in the US. Other than that, my name is Jennifer, your guide to your Medicare and retirement, and I will see you in the next video. Thank you so much.